right? Every physician is burnt out, and they're not burnt out because they hate what they're doing. They're burnt out because they hate dealing with the healthcare system in this country. They hate it, right?
Yeah.
And so I'm sort of lucky that I'm able to keep a practice like this going and sort of transition to this model.
I do want to ask some questions around your practice, Dr. Myers, because
Sure.
you are all pay. Is that, you can't just do that for, you have to build your practice, build your reputation to get to something like that. Has that always been the goal, or has that been something that you have had to adjust due to the economics?
Yeah. Wow. How long do you guys have? Right. Like we can talk about this week and
I'm
a
here all
half.
day.
We might run out of recording time. Um, yeah. So that is definitely not the norm, right? For orthopedics. Um, the way that the healthcare system has been changing recently, as you guys probably know, is that it's more about consolidation and about sort of large groups, hospital-based care, big academic orthopedic practices, right? The private practice physician is sort of a dying breed, and certainly a solo practice physician in surgical specialties is a unicorn, right? Like no one is really doing that anymore. Um, and honestly, I've been in practice for 22 years now, and that's what they told me 22 years ago. They're like, you can't just go out and hang out your shingle and be a country doctor on the corner, right? Like you'll never survive. You either have to go get a job for a hospital, or if you have to join an established orthopedic group, or you might start wherever you did your training and do your fellowship and then come on as faculty at a big university. And that's kind of the way that the healthcare system has forced people to do that, because the administrative burden of running a medical practice is almost impossible um, if you're a busy surgeon, you know, and you'll end up hiring 20 people just to interface with insurance companies to get you paid, or to let you do the cases that you want to do for every one surgeon that's in the practice, right? So they told me that 22 years ago, and I was like, yeah, but I'm different, right? I'm going to be able to do this. And I just never really listened to anybody. And I did it. I started my own solo practice, and I've been a solo practice doctor here in Atlanta this whole time. Um, the the benefit of doing that is autonomy, right? Like I clearly don't work well with others, right? And so the idea of running your own business, deciding what patients you see, deciding what patients you don't want to see, deciding, what insurance plans that you take, and deciding what insurance plans you don't want to take, deciding what hospitals you want to work at, deciding whether you want to take call or not. All of those decisions are yours, as if you're running your own business. If you are working for a large group or working in a for a hospital system, none of those decisions are yours, right? They will tell you how often you take call and what emergency rooms you cover. They will tell you what clinics you're going to see and what insurance companies you're going to take, and what reimbursement levels that you will accept. And then they salary you, right? So you've gone to medical school and done all of this training in your life, and now you're sort of a salaried employee. And your boss, who is maybe a hospital administrator that did worse than you in school and went on to get an MBA and now runs your life, that guy is telling you, hey man, we looked at your production last year, and you're a little bit slow, so we're going to send you out to a satellite clinic that's a 2-hour drive away on Fridays, and you're going to see some patients out there, right? I mean, and you have to do that, or they're like, well, you're not productive enough, so we're going to cut your salary, or you're not going to get a bonus this year. And so you're now a commodity, right? Like you're a cog in the wheel. And there are a lot of doctors that went into medicine that didn't think they would give up that autonomy, you know. And and I was just like, yeah, like no one's going to tell me how to practice, and how to, and who I want to see. And so I was lucky, like I was able um to keep my practice going early, and build a reputation. Interestingly, I never spent a dime on marketing. I just tried to do a good job and get patients sent to me via word of mouth. And eventually over time, I kind of built a good referral network that was mostly from previous patients, and I was able to sort of survive over this time. I haven't taken call in 22 years. I didn't take Medicare or Medicaid, or any government insurance. I only took private insurance or commercial insurance. Um, I got to the point where I stopped doing like hip replacement surgery and trauma and all of that kind of stuff, and I just did knee and shoulder and elbow arthroscopic procedures. So I was able to kind of just hone down to the cases that I was good at. I got to the point where I saw mostly young people, and part of that is because I didn't take Medicare, right? And so you don't see the 65 and older group. So most all of your patients are younger and athletic. And being a sports medicine doctor, I worked on people that were mostly healthy, right? And so that's a huge advantage, right? If you're not taking care of sick people, interestingly, your outcomes are very good, right? And so it was a very it was a very good move, at least for my personality, to be um, to be independent and solo, doing mostly outpatient surgery, so that I really didn't have to have anything to do with the hospitals.
Yeah.
And I was able to kind of build a nice practice where I was as busy as I could be. Like I was doing between 400 and 450 cases a year, which was about as busy as I wanted to be. And that was, carving down just to the patients that I wanted to see and the cases that I wanted to do. And then a little before COVID, like sort of leading up to COVID, and then definitely after COVID, like things changed in the health insurance industry, right? Like there's all these problems which we can go into ad nauseum with having to get prior authorizations to do surgeries, having all of your insurances started denying payment for things that they used to pay for. And even now, like today, there's now AI algorithms that will just automatically deny your claim because you missed one sentence in your operative report or something like that, right? And then you have to fight that and appeal that and all of the stuff that goes on with that. And it was to the point where I had trouble hiring enough administrative help to just get paid for what I was doing, right? And then it got to the point where insurance came in and said, look, we're not going to let you fix this patient's rotator cuff because they haven't had 6 weeks of physical therapy. And you're like, look, this patient's had a rotator cuff for a year and a half. They can't lift their arm. It's retracted 3 centimeters. They are not going to respond to physical therapy. You need to let me take this patient to the operating room, right? So now you're begging an insurance company to let you do a case and they have no experience. They didn't see the patient, right? It's some either
Yeah.
AI algorithm or bureaucrat telling you you can't do the surgery. So now you're doing peer to peers, on a daily basis just to ask permission to do surgery. And then when you do that operation, they only will pay you for two of the five codes that you build because they're bundled, you know, into the other codes. And so that's their way of cramming down a 4 hour rotator cuff repair and paying you $2,200. So it got to the point where I was like, yeah, I mean, I am in a pretty good situation in that I have my autonomy, but I can't continue to practice the way that I want to practice with insurance companies telling me what to do. And then there's a whole other level that I could go into, but I won't. But it has to do with the idea that it's basically a socialistic system where everybody gets paid the same. Like you contract with an insurance company, and if you are, let's say you're contracting with United Healthcare, and you're a surgeon that just got out of fellowship and you've done, 5 cases on your own, and you do that same rotator cuff repair, you'll get reimbursed the same for that repair as I do, having had 22 years of experience and having, better training, better education, better everything, right? Like you can't, if you're a higher level surgeon, you can't bill a premium for your surgeries, right? So the only way you get ahead is to do more, right? You see more patients, you do more surgeries, you know. So what happens there? Well, that that means that reimbursement is tied to volume rather than tied to quality. So now you've got guys that are trying to do 10 total knees before noon, right? And you've got guys that are trying to see 65 patients in a clinic, right? Because the only way that you can get paid more is to see more volume. And if you're seeing, that many people in a clinic, you're spending 2.5 minutes with your patient, or you have a PA or a nurse practitioner that's seeing that patient for you. And that's not great doctoring, right? And so I chose to practice differently, right? So eventually, to answer your initial question, right, it got to the point where I said, look, this is my business, this is my ability to practice, and I have the autonomy to choose, who I get to pay me, right? And so I decided to just be out of network for all insurance plans altogether and see what happens, right? And I have the ability to do that. Like if you worked for a hospital, you would have no ability to do that. They would laugh at you, right? If you work for a large orthopedic group, like the local groups around me, they would laugh at you too, right? Like there's no way that, either the entire group would have to be out of network entirely, or or the entire group have to stay in network. Like you don't have the ability to
Yeah.
decide whether you want to see Medicare patients or not, right? Like the group decides and everybody goes along with it.
Yeah.
So as a solo practice, I have the ability to do that. The other reason that it's actually working is because I have 22 years of practicing in the same place, and I have a pretty good referral base where people will come and see me and pay out of their pocket anyway. Whereas you couldn't really do that if you're just starting practice, or if you've only been practicing for a short time, right? Like you have to kind of build your brand and have an established business in order to do that. So I kind of had a unique scenario that allows me to do that. Um, and surprisingly, it's an interesting study in human sociology. I'll get a patient where when I was taking insurance, the the case would happen and the insurance company would deny it and it'd get it appealed, or we would have to fight the payment, and it would take a year or something. And eventually they would say, look, we're going to pay all but $67 of this, and that $67 needs to be billed to the patient. So you're like, okay. So you call the patient, 18 months later and say, hey, remember that surgery you had a year and a half ago? You owe me $67. And every patient will be like, absolutely not. No matter what their economic situation is, no matter how rich they are, no matter how good you did or how good an outcome they had, they will fight tooth and nail. They will be like, I paid that. You guys sent me a million statements. I had 20 phone calls with the insurance company. There's no way that I'm going to pay you that $67 a year and a half later. Now you take that same patient and you say, look, I'm going to do that operation. But before we go in and do this surgery is going to cost you $3,500 out of pocket, right? You have to pay me. Your insurance will pay for the rest of it, but that's what it's going to cost you, $3,500. They'll happily pay that, right? It's such a weird thing. Like they will fight hard against the insurance company that was supposed to pay 100% of it, and then they didn't. And they're like, you know what, doctor, I'm going to screw you. I'm not going to pay you $67 a year and a half later. But if they know up ahead and there's price transparency, they're like, this is what you're
Yes.
going to get. This is what you're going to owe. And I'm never going to bill you another penny. Like you'll never get a statement. You'll never get anything else. You pay this. That's the end of it. They're like, okay, I can budget it. I think I can afford it. And I have a whole bunch of patients that are actually willing to see me and happy to do that because they think, whether it's right or wrong, they're getting a better level of care, you know? And it's a little bit interesting because if you go to some high-end boutique and you buy a purse for $6,000, or you go to Target and get a purse for, $15.60, your impression of the high-end purse is that it's a better product because you paid so much money for it, right? In the world of third-party payers, people are kind of like, well, I don't know how much that was worth. He did a good job and my knee feels better, but my insurance company paid for it and I don't even know how much they paid him. Like
A
he's a
reference.
rich doctor. They probably paid him like $50,000 for it. And in reality, they paid you $1,200 and the patient has no idea. So it's been an interesting social experiment for me. But what it's done is it's allowed me to provide better care. Like I now have between 18 and 20 patients a day. I sit down and talk with people for 30 to 45 minutes about their injury.
Wow.
They are well informed, have a good relationship with me,
That's excellent.
and they are happy to sort of pay that money up front, knowing that the rest of the hospital bill for the surgery is going to be billed to their insurance. And they're often shocked at like, I'll tell them, look, this is going to be between $2,500 and $2,800 that you have to pay me. And they're like, that's all you get to do this operation? like, yeah, that's what we're getting reimbursed. And they're shocked. Like most of the public thinks that it's like 10 grand or 20 grand or something like that the surgeon
Right.
gets. And it's really not. So it's been a really good experience. It's allowed me to practice better medicine. Am I making less money? Probably, right? I mean, I certainly don't have the surgical volume that I used to have, but I have half the staff that I used to have, and I have a tenth of the headache. And I think if you surveyed doctors that were 20 years in practice and asked them would, if they could do it, would they do this model? They absolutely would, right? Every physician is burnt out, and they're not burnt out because they hate what they're doing. They're burnt out because they hate dealing with the healthcare system in this country. They hate it, right?
Yeah.
And so I'm sort of lucky that I'm able to keep a practice like this going and sort of transition to this model.